Member for Richmond North Centre.
Thank you, Honourable Speaker. I'm pleased to rise and deliver a statement on something causing deep concern: the open consumption of illicit drugs in our public places. Members of this House have heard from numerous communities across British Columbia who share concerns about this issue. Families are forced to worry about their children stumbling upon drug paraphernalia in our parks and playgrounds. At the same time, hazardous items such as discarded needles are a common sight in our neighborhoods, posing a danger to both residents and visitors alike. I know I'm not alone in being critical of the government's haphazard handling of decriminalization in our province. The decision to decriminalize hard drugs without proper guardrails has exposed our communities to the dangers of uncontrolled consumption in public areas. While simple activities like having a beer in a public park or using a public straw are tightly regulated, the government's decriminalization policy has left the public consumption of lethal drugs like crystal meth, crack cocaine, and fentanyl unchecked. Seeing no accountability from this government, municipalities across British Columbia are being forced to come up with solutions on their own, with the introduction of bylaws to mitigate the harms of open drug use. However, they face the resistance from the provincial government and legal challenges from organizations such as Pivot Legal Society, the Premier's former employer. Penticton, Kelowna, New Westminster, Kamloops, and Campbell River are just some of the communities trying to put at least some controls in place. Unfortunately, Honourable Speaker, these efforts are insufficient without the provincial government's support. Under this government, open drug use can go unchecked in the same parks where parents are watching their kids play. Last week, we heard of parents like Andrea Miller, whose daughter Evelyn found a packet of fentanyl at her elementary school playground in Nanaimo. No parent should have to live in fear for their child's life because they might stumble across drugs and dangerous drugs like fentanyl on their playgrounds. Honourable Speaker, this House Health Committee makes the recommendation that if the government is going to pursue decriminalization, that has to make sure that protections are in place. Most members of this House understood the purpose and need for decriminalization because we were told that the safeguards would be in place. Sadly, however, this government has not followed through on the requirements that should have been met prior to implementing decriminalization. This includes improving access to health services, meeting specific regions and communities' unique needs, educating the public, and providing training and resources to frontline police officers. The lack of preparation has and will continue to result in disastrous consequences for our communities. After 7 years of a public health emergency, the province continued to set one grim record after another. In 2022, our province recorded the highest number of overdose deaths ever recorded. March of this year was the highest month on record for overdose deaths. We have seen the highest number of overdose calls in a single day, and the highest 30-day average of overdose calls ever recorded. These are unacceptable outcomes that we must address with the same urgency that we approach the COVID-19 pandemic. We need a comprehensive plan to address the open consumption of illicit drugs in our public spaces. We must protect families and children. We need to provide support to municipalities and frontline workers to mitigate the harms of uncontrolled consumption. We need to meet the unique needs of our communities, including those in rural and remote areas. We must educate the public about the dangers of open drug use and provide access to health services for those who desire treatment or other support. It is time for the government to listen to British Columbians and stop us from going down this path of uncontrolled consumption of lethal drugs in our public spaces. Thank you, Honourable Speaker.
Member.